Good morning, everyone. I am Srija Vijayan, registered nurse at Dubai Physiotherapy and Rehabilitation Center. Today, we will discussing about the topic is bowel retraining. Introduction. Bowel incontinence is a significant problem that affects a small percentage of people older than 60 years of age. Changes in a person's diet, activity level, medication, and routine can adversely affect a client's bowel pattern and result in a constipation or diarrhea. Prolonged constipation can lead to fecal infection, a serious health condition, and a sentinel event in the outcome measures used in a determining quality in long-term care. Clients who has health problems like stroke, immobility, or any other major health changes that are associated with bowel incontinence face even more challenges. What is bowel retraining? Bowel retraining is a conservative treatment that is generally aimed at people who have recurring constipation or diarrhea or limited or reducing sensation in their rectum due to nerve damage. Aim to improve the consistency of your stools, to establish a regular time of you empty your bowels and to find ways of stimulating your bowels to empty. Bowel retraining and management program. The goal of a bowel retraining and management program should be to alter the patient dietary, medication, and activity plan to allow for regular bowel movements without using laxatives. First one, taking a bowel history. Second one, keeping complete record of bowel movements. Third one, increase fiber intake. Fourth one, using bowel evacuates. Fifth one, ensuring adequate fluid intake. Sixth one, maintaining maximum physical mobility. Bowel management history. When a new patient is admitted, it is important to determine his or her bowel history and how much he or she relies on aid for bowel movements. Review the patient medical record for a history of underlying medical conditions or surgical procedures that may increase the risk of constipation or fecal incontinence. Review the patient's medication regimen. Check for any medications that affect bowel activity, including analgesics, antibiotics, diuretics, iron preparations, opioids, etc. Second, record all bowel movements. During each shift, observe and record the client's bowel movements and communicate any problems. Careful record keeping, clear communication are necessary to identify early changes in the client's normal pattern and prevent serious complications such as constipation. Increase fiber intake in the diet. The client experiencing constipation may benefit from having more fiber-rich food for diet. Fiber from dietary sources such as whole wheat, bread, grains, and vegetables should be added first. Dietary sources are ineffective supplement fiber ordered to be administered by mouth. Use bowel evacuates. The physician and physician assistant may order various medications that can be used to empty the bowel also. Purine juice, lactulose, and milk of magnesia can help bowel movement and prevent both constipation and incontinence. Sometimes physician orders suppositories, enema, or digital stimulation. These treatment also treat both constipation and incontinence. Ensure adequate fluid intake. A person must have adequate fluid intake to produce soft stool. 1500 and 2000 cc of fluid intake daily. This can be taken during meals, snacks, and medication administration. Keep accurate record of all fluids offered and consumed by the patient. Bowel retraining steps. Keep a diary of bowel movements for 2 weeks. This information will be helpful in determining whether there are any particular times of the day or specific situations in which your body is more likely to initiate a bowel movement. Second one, establish regular and consistent meal times. Feeding your body on a regular schedule will encourage digestion to occur according to a more orderly pattern. Third one, do what you can to contribute to the development of soft, well-formed stool. Drink plenty of fluids to keep your body well hydrated to minimize the amount of water that the colon will need to pull out of stool matter. Pick a regular time for your bathroom visit. It is very important that you schedule time of your bowel movements every day at the same time. Fourth one, morning is often an optimal time for most bodies. Fifth one, another advantageous time is 20 to 30 minutes after a meal because eating stimulating bowel activity, passing stool immediately after a meal is usually the result of gastrocolic reflex, which is a normal bodily reaction to food entering the stomach. Sixth one, prior to your bathroom visit, try to stimulate a gastrocolic reflex. This is natural bodily response in which intestinal contractions are triggered by eating or drinking. Each of the following can serve to strengthen the intensity of colonic contractions triggered by the reflex. At breakfast, add a soluble fiber. Drink any kind of hot beverages. Ingestion caffeine. If you can tolerate the substances without irritating your digestive system, make yourself as comfortable as possible as you sit on the toilet. Use relaxation exercises to keep your body calm and at ease. Listen to music or read something that is stimulating and entertaining. Use your abdominal muscles, not your rectum. Be careful not to try to force out the stool by putting unnecessary strain on your rectum. The goal is to work with your body as you feel the sensations of the colon trying to pass the stool. How to avoid incontinence? Quit smoking. Smoking can help promote incontinence because smokers' cough puts increasing stress on the bladder and pelvic floor muscles, which in turn can lead to stress incontinence. It stimulates the bowel and increases the urge to have bowel movement. Practice pelvic floor exercise. Pelvic floor exercises treat incontinence by training and strengthening the muscles that area responsible for holding your urge to urinate until you reach a toilet. Manage weight. Maintaining a healthy weight is essential for preventing incontinence, as excess fat surrounding the organ can add to the pressure and strain on the pelvic floor muscle. Maintaining a healthy weight allows all your organ need to work the best capacity and keep stress off your bladder or bowel. Reduce caffeine intake. Caffeine is an irritant to the bowel and adds to the symptoms of incontinence. Switching to herbal teas and decaffeinated beverages. Avoid or reduce the alcohol consumption. Alcohol is an irritant and risk factor for incontinence. Get adequate fluid intake, drinking 6 to 8 glasses of fluid per day. Eat nutritious diet. Eating a healthy diet of mild flavored food, fiber-rich food, fruits and vegetables help to keep incontinence. Avoid acidic and spicy foods. Control constipation. Chronic constipation is one of the leading risk factor of bowel incontinence. This effect of straining during a bowel movement can cause pelvic floor muscles weaken. Tips of success. This lesson will list some simple tips to keep bowel working well and hopefully prevent bowel problems such as diarrhea, constipation, and accidents. Stay on schedule. Do the bowel program at the same time each day. Do the bowel program it in rehabilitation. Try doing the bowel program 30 minutes after a meal. This may help with MD. Massage the abdomen during the bowel program. Do not take laxatives or enemas unless your doctor tells you to do so. Drink 6 to 8 glasses of water daily. Eat a balanced diet that includes fruits, vegetables, and whole grains foods. Drink a hot or warm drink like coffee or tea 30 minutes before the bowel program. Sometimes a warm beverage helps the bowel to empty. Do not skip the bowel program or do the halfway. This can cause constipation and bowel accidents. Avoid foods that are cause diarrhea, spicy foods, alcoholic drinks. Avoid a limit foods that cause constipation. Exercise regularly. Thank you.